Hi
Hi,
guys.
welcome to Health
Health
Beats.
Beats.
This is Katie here, health and wellness coach.
This is Hanana Quill, RN.
And we are so excited to be here, episode 7,
Season 1.
to talk a little bit more about our personal health journey. We have a really, really awesome and incredible guest speaker that is very close to home, especially for Hanan. So we are very excited to introduce him. Hanan, do you want to introduce
Yeah,
him?
if don't mind if I do. This is Dr. Joseph O'Donnell, the one and only.
Thank you.
And who is Dr. Joseph O'Donnell, Hanan? What is his title? What does he do for health?
He's a PhD in psychology and he specializes in neurofeedback training for people with mental disorders, illnesses.
Well, welcome,
Well, thank you.
Dr. Joseph O'Donnell. We're so happy to have you here to speak to us a little bit about what you do and how you help others. And
Yeah, I mean, he was one of the founders of neurofeedback, I believe, correct?
Well, I was one of the founders in the Chicago area, but the concepts themselves predate me by 20 years. So, but I've been a pioneer in the Chicago area.
That's incredible.
Yeah.
What got you into neurofeedback?
Well, what got me into it was one day I was at a convention and someone pulled me aside in one of the exhibits and said, "Are you interested in working with children with attention deficit disorder?" Because I work with addictive disorders, I said I was because a lot of people I saw who had addictive problems had a history of ADD. And he said, "Would you be interested in looking at an alternative to treatment for kids who have attention deficit disorder?" So he introduced me to this principle or concept of neurofeedback. He was selling me equipment, obviously, and he obviously had an economic reason, but he introduced me to a professor of psychophysiology at University of Tennessee. And I went down there and I met with him. I spent a long weekend with him, and he showed me the principles behind what he basically did. And that is how I got into neurofeedback. That is based upon the principles of learning theory, that you can actually train how the brain works based upon the feedback that the brain will get from itself that will tell the individual that his brain is at a level consistent with what he should be doing in terms of attention and concentration. And that's how I got involved in it. And it turned out to be a real, I'm going to call it a lifesaver, but certainly in terms of a career saver for a lot of young people that we work with who have a history of attention deficit disorder.
Wow, that's incredible. Can you tell the audience what neurofeedback is in the most simplest and easy to understand way?
Okay, neurofeedback is essentially brain training. We know that the brain is a central processing unit of the human body. How the brain works is how we work. We know what a normal brain looks like electrically. If we can measure the brain of someone who may have a problem, for example, with attention deficit disorder, and we know that the electrical signals are not working the way that they should, it will show up in the type of evaluation that we use. We call it a quantitative EEG. It is an EEG, but not a classic EEG that looks for seizures. We're not interested in seizures. We're looking for patterns of electrical activity that we know that are consistent with attention deficit disorder. So we'll collect the information and we will do a statistical mathematical analysis of the data we get. We will compare that data to what a normative database to get some ideas of the variance that, say, a young person's brain may have in terms of attentional issues. And so by doing that, we can develop a treatment protocol that will teach that individual how to retrain their brain to function at a normal level electrically. Because through our evaluation, we know that it is not working properly from an electrical perspective. And that is, in essence, the nutshell of what we do. In the concept of attention deficit disorder, there are several subtypes. The classic subtype is the brain moves too slow, so the doctor puts you on Ritalin. The beta subtype, which is a faster one, the brain moves too fast. The principles and the symptoms are the same. And so when we look at that, the brain map gives us a very clear picture of what subtype that we're looking at. So let's use the normal one, which is slow wave activity. So if we see brainwave activity that's moving too slow, in other words, high voltage in a lower frequency range, we call them delta and theta and alpha. When the voltage of that is too high, the net effect is that the brain is moving too slow. And so by identifying that, we can actually train the brain to reduce that voltage in the delta, theta, and alpha and increase the voltage in the higher frequencies, which we call beta. When you actually train the brain to balance itself out that way, pretty soon you begin to see that the attentional issue begins to modulate. And the child begins to focus better, stay on task longer, complete his tasks, listens to his parents, listens to his teachers, and engages in an activity that will help him perform in the school setting at a more normal level. So that in essence is what neurofeedback, it's based upon learning theory. What learning theory is very simple concept. If you reward a behavior, it increases the probability that behavior will occur again. What are we rewarding? We're rewarding a reduction in some voltage and an increase in another. We do that through the format of biofeedback. We'll attach an electrode to the spot on the brain that we've determined through our quantitative EEG as being the region of interest. If we see that the voltage is too high in the low frequency band, our goal is to reduce that. So we set up treatment goals. And the treatment goals work like this. Every time that brainwave activity moves from the average high to a lower level that we want it to, let's say 18 microvolts, the computer will let that child or that adult know that it met the goal. How does it do that? Well, you will hear a sound. It'll go beep, 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 beep. Could be in the form of a video game. Could be Pac-Man gobbling a ball up. It could be a movie that turns on and off based upon your reduction in that voltage. And when that occurs, what you're going to begin to see is a trend line, because the brain will interpret that sound and that feedback as a reward. If it's interpreting it as a reward, it's going to want to do it again. So the net effect is, as the brain gets rewarded for reducing the voltage, over time, the average voltage will come down. Then we set up a new goal, and we go through the same process over again, and then the same process over again until we reach what we would know to be the norm. When it reaches that point, the net effect is the child or whoever we're training should be exhibiting, and usually does, in over 90% of the cases that we work with, an increase in their ability to pay attention, to focus, to stay on task, to listen to instructions, and do all the most important things that it takes for being a good student. And that in a nutshell is what we do.
Very
Wow.
fascinating.
Yeah.
Wow. So I know you and I had mentioned this before. We were speaking about this before the podcast. For those in our audience who do biofeedback, so neurofeedback is then a subset of biofeedback, correct? So it's a specialization of it, specifically targeting attention deficit.
Yes, it is. There are many forms of biofeedback. Certainly, the brain training is one of them. There can be muscle training. We call it EMG, or skin temperature training, heart math variability, which looks at breathing as it's correlated to heartbeat, which can affect stress and tension and things like that. So there are a number of factors that forms of biofeedback. Neurofeedback is just one form.
Okay. And so the scope of your practice, it's not just for children either, right? It's of all ages, all backgrounds.
Exactly, because the brain is a very complex organ. And when the brain is working in different regions of the brain, because we know through research that different regions of the brain are linked to different functions. If we see an irregularity, for example, in an area of the brain that's linked to auditory perception, and a child comes in and has a difficulty with auditory attention, that stands out. If depression, for example, can often be linked to the left frontal, the lack of activity in the left frontal region. Impulse control issues can be linked to the right frontal region. Sensory issues can be linked to the right posterior temporal region. Visual issues are linked to the occipital lobe, which is in the back, the visual cortex. Attention and concentration generally can be linked to the midline. And so there are all kinds of factors that we look at. The frontal lobe, the prefrontal cortex is linked to things like short-term memory, planning, organizing, decision-making, and other issues, emotional issues like anxiety and stress, as well as depression. And we can look at those things and see if there's an irregularity based upon what you came in to see me with. We can train that. We can direct our training towards that to normalize the activity based upon what we see in their quantitative EEG.
Interesting. So you have quite a few different cases. I'm hearing anxiety, depression, attention deficit.
What other conditions do you treat?
Well, like I said, attention deficit disorder, we've done a lot of work with autistic children. Autism is a very complex kind of disorder that involves many different aspects of how the brain actually works. And so when we do a quantitative EEG with an autistic child, we can see a lot of things that are going on with the brain. Many of it is being exposed to novel experiences. They get very frightened and anxious, and we know the part of the brain that's linked to it. They often have sensory integration issues, that any form of sensorial, oversensorial kinds of experiences will turn them into an emotional state. And if we can balance that out, we have a lot of connectivity issues. Connectivity issues essentially means how the different parts of the brain communicate with each other. What we find with autistic kids, that there's a lot of issues of connectivity in the frontal lobe and also from the front to the back. And that's a very common issue that we often see with autistic kids. I think one of the first and most important things that we work with when we see them is just to calm them down, because any form of novel experience will set them off in some type of reactivity. By teaching them just to manage their feelings a little bit better, by teaching them how to manage the frequency ranges that are linked to being aggressive, upset, and overwhelmed, if we can normalize it, we've done an awful lot with them. And of course, we have a lot more to deal with, because I've got some autistic kids I've been working with for a long time. And we take care of it a little bit at a time, but it will work over time.
Yeah. I'm in neurofeedback right now, and I have beta subtype ADHD. And growing up, I struggled with emotional regulation and maintaining focus and attention. More so my executive function skills. I would not really make the best decisions for myself. I mean, I did well for my life, but I feel like my social development was a little delayed because of the emotional regulation issues I had. And going through the training I've gone through with Dr. Joe, it's really helped me a lot to become more centered and more calmer and be more clear in my thinking, and just calmer in how I handle situations and how I interact with other people. So it's made a big difference. I've done this since January. Right now it's August, and there's still some more training to do. So it's not a quick fix. It is a journey that you start when you start it, but you do see results if you're willing to be consistent with it.
And that's very true. I would say in over 90% of the cases, like with ADD and ADHD, we do see success. And we do see some improvement, the reduction in anxiety. We're almost 100% reduction in anxiety with a lot of the patients that we work with.
Now, do the patients have essentially homework to do after the therapy? Is it just the therapy and let the therapy kind of do its thing? Or do you have the patient do things afterwards to help calm them down or experience those sensations again?
Good question. We don't. We do make recommendations in terms of things that may create anxiety for them. For example, I may instruct them on how to do progressive relaxation when things bother them, or how to defocus themselves away from anxiety-provoking events, or doing other forms of self-regulation when they feel like they're feeling overwhelmed. But outside the context of what we do, we can't take the machine home with them, because we just can't, obviously. But if you just did the training in and by itself over time, you're going to see changes. You're going to see changes.
And so this training is very different than what you would find maybe in a pill, right?
Exactly.
And some sort of medication.
I often tell patients that I'm not a physician, so I can't recommend whether you should or should not use a medication. But from my experience as a layman, I find that oftentimes medication just works for the time that you're on it. What we found with our methodology that over time, you don't need medication anymore. And many of our children have come off of medication and have been able to function at an appropriate level without the meds. And so it has been a good thing. If you can reduce anxiety, the net effect is, do you need anxiety reducing medication anymore? It's just a question I'm throwing out. Every patient has to make that decision for themselves in conjunction with their doctor. But we've seen a lot of our clients who have been able to get off of their meds after they've done the training.
Wow, that's incredible.
What is an inspiring or a couple of inspiring stories of patients that you've seen or worked with?
Well, there's virtually many. One young boy I worked with, I think he was a senior in high school, and he wanted to go to college. His mother brought him to see me, and had severe ADD. He was on medication. He was so fearful of coming off of the meds that he wouldn't come off of it even while we were doing the training. But the training was having an effect, because when we did follow-up assessments, we definitely saw an improvement. Well, it was at Christmas time that he decided, his mom usually took him off of the meds over holidays, and over Christmas time he went off of the meds, but decided not to go back on the meds, and he just took off.
Wow.
I mean, he just got into college, passed all of his ACT tests, and did quite well. Those are some really good results that we've gotten with a lot of our clients and a lot of our patients. I would say the bulk of ADD and ADHD clients that I've seen and I've worked with from mild to severe, we've seen improvements in them, almost 90%. We did, one of my students actually is a graduate student who did a study in 107 of our ADD patients, found statistically significant reduction in the voltage, in the frequency that we knew that was linked to attention deficit disorder. Anxiety disorder works like a miracle for many people. And that's all we have to do, is actually just do the training. Typically in an anxiety disorder person, we're seeing high elevations in fast frequencies. And so the brain is overly jittery, if I can put it in any other term. By calming the amount of voltage in the higher frequencies down to a normal range, we begin to see that they settle down. We don't eliminate anxiety-provoking events. What we do is they learn how to manage their response to them much better than they had before, because their brain is now functioning within the normal range. And we've seen tons of anxiety issues resolved with a lot of our clients.
Wow.
With our autistic children, you name it. I've got one of my kids, he's not a kid anymore. He just started college. And we were lucky we got him out of high school. And we're also working with his brother. And his brother is just graduated from high school. Still has some work to do, don't get me wrong. But we've helped them reach that point. They've been successful. Parents are really just grateful that they found this.
Imagine. What a triumph to know that this is helping people get off medications.
Well, that is certainly a positive, because many of our clients have severe side effects from the meds.
Right.
And by getting back into a normal regimen of not being on meds, certainly makes them feel normal again.
It's hopeful.
Yeah. And hopeful that they don't have to be on a medication their whole life.
And so I'm sure you're seeing this now too, kind of this, what I call an epidemic of anxiety. It seems like anxiety disorders are just on the rise. So now my question for you is, from your understanding, is anxiety disorder something that we're born with, or ADHD something that we're born with, or what is the onset of that?
There's a couple things. Our human brain, there are two factors that influence how we behave. One is genetic, what we inherited from our family and from the people who are close to us. The other is what we learn. And what we learn is our interactions in our daily life in just living. When we get bit by a dog, we may have loved dogs prior to that. When we get by a dog, we've learned to not like dogs anymore because we got bit. That's a learned response. Post-traumatic stress disorder, which is often a very common thing nowadays. I worked with Vietnam veterans years ago when I worked for the VA. Again, you have this ingrained learned response that It affects their life and their response to many issues in their life, including their relationships, et cetera, et cetera.
Yeah.
When we brain map these people, we're able to identify those regions of interest. So the two areas the point I'm trying to make is we have a congenital aspect, but we also have triggers out there, learned behaviors and certain triggers that we respond to. And if it's a learned behavior, we're going to respond much more intensely to those triggers than someone who didn't have those kinds of experiences. And so when we do a brain map, we can identify what those are. And so the net effect is if we re-regulate that, then pretty soon over time, you're going to begin to see that they're managing those feelings much more appropriately and much better.
Yeah.
It isn't that they're going to escape anxiety-provoking issues. It's just that they're learning how to manage them better. And I see that. I've worked with women who have been sexually and physically abused. I've worked with men, again, who have experienced a lot of trauma in their life due to war and other things. And all of a sudden, when you begin to normalize that, they begin to respond to their environment in a more normal, acceptable sort of way. And
Almost
we see
as
that.
if you're going from the fight or flight response
Exactly.
to activating more of the parasympathetic nervous system. That
You said it better than
relaxation.
me. Yeah,
Yeah.
exactly.
Yeah.
It's not an overnight fix.
No.
It's about being patient with the body and letting the body re-regulate itself.
And you becoming aware of how the body re-regulates itself and how you feel. And that's an important piece in that whole process, that awareness. What were you going to say?
Sorry to interrupt. So I wanted to also mention on the podcast that Dr. Joe and I have spoken previously. He's also treated people with addictions
Yes.
as well, like alcoholism,
Okay.
right? And brain injury.
I have.
Maybe it's not as common, but that is also people who have those conditions could also benefit from neurofeedback.
Well, with the alcoholic, what we find is that when we measure their brainwave activity, they have increased amplitude in the fast wave region that we call the beta. And so for those who drink, and I'm sure the majority who listen to this has probably had a beer once in a while, the net effect is, it gives you that soft, mellow feeling. What we found out with alcohol, and what are the research that's shown with alcohol, when we drink, it takes our brain from that high energized level down to a calm level. We call it an alpha state. It's the alpha rhythm. And alpha rhythm is essentially relaxed, aware region.
And alcohol is a depressant.
Exactly.
Right? So,
exactly. So it puts you into that. So it makes you feel better.
yeah.
So if it makes you feel better, what are you going to do? If you're anxious all the time, you're going to have another drink and another drink. The downside of alcohol is over a while, you develop a tolerance for it. So you need to drink more and more to get to that point. And then at some point, you just continue to drink so you don't go through withdrawal. So we can train the brain, and there's a protocol that we use with alcoholics. It's called alpha theta training, where we can actually increase the amount of the slow wave activity and create it and diminish the power in the faster wave activity where the brain is more balanced. So if you're taking away a major trigger to drinking, the temptation to drink will lessen.
Wow.
I'm not going to say we're going to convert them from being an alcoholic, but certainly it's going to take away a major incentive for drinking. The urge.
Yeah. And so kind of bouncing off that, have you dealt with some but extreme cases like Alzheimer's or coma or strokes? Have you dealt with any of those sorts of cases?
Dealt with all of those. Stroke patients, I've had a few, not a lot, where you actually see destruction in brain tissue. There's a lot of problem. We call it coherence issues. Usually it's linked to the connectivity between the neurons. And you can actually retrain the neurons to improve that connectivity, where you begin to see some improvements in terms of how they function. Common left brain strokes is a left frontal is very common type of stroke. Depression is very common side effect with that type of stroke, and you can actually focus on the depressive protocol that will actually work in stabilizing the amount of alpha wave relative on the left side versus the right side. Those are certainly things that we've used with stroke patients, head injury clients. I'm working with several head injury clients right now. The downside of working with head injury, particularly if neurons have been damaged, is you're not going to be able to replace those damaged neurons. but you can improve connectivity where functioning will begin to improve. Because we know that. Even doing, I've got a client now who was beat up and he has a lot of right side damage. He's been going through all kinds of physical therapy and speech therapy and all the rest. And he's showing improvement. And he's coming to me because he wants to go to a higher level. And that's what we're working on. And we'll probably see it with that type of thing.
Wow. So then it sounds like you deal with athletes as well. If you're dealing with a lot of brain injuries like concussions.
Yeah, I've done a lot of work with concussions. I've done work with stroke patients and things like that. Dealt with athletes. I worked on an addiction unit, and I had a number of athletes up there who the sports I would shy away from, and don't get mad at me, audience, is probably football, hockey, and wrestling are the three biggies, because that's where you're going to see the most of the head injuries are going to be involved in, and that's most of the people that we've worked with.
Those
where we
high
see
contact sports.
the what?
The high
The contact sports. Yeah.
Okay, so myself, I've gone through a few concussions through sports as well. One through a car accident and one through snowboarding. Now, I don't feel like I have any symptoms from those concussions afterwards. This has been years now. Would you recommend somebody like me to do something more proactive for my brain health and hope that it kind of helps? Because I know concussions can have an impact on you, maybe not in the short term, but much more in the long term. So that is a fear of mine.
Well, the only way to find out is if you were to do a quantitative EEG to see if there's any irregularity in a certain region. A lot of times they're very difficult to identify because maybe the variances may still be within the normal range, but say in the low normal range. And when you look at that, and based upon what your history is, where the concussion occurred, where the head injury was, we would make a judgment about that, and also get very much into what were some of the side effects after you had the injury, like speech or sleep disorder or other factors that may have affected you in the short term after the injury. And say I see you 10 years later and I'm seeing a little bit of slowing over here, I might ask you the question, because that's what I typically do. A lot of patients come into me for one thing, and I will see something else, and I'll ask them a question. You ever had a head injury? Oh, you had a concussion, maybe 3 or 4 concussions, maybe when I was about 10 or 12. And I said, oh, okay. They may be 25 now, but like you said before, will you begin to see more significant changes later on in life? I'm glad you asked the question, because I just interviewed a client that was exactly the case. And he had a history of 7 concussions. And now all of a sudden he's beginning to see the effects of that concussion now that he's in his mid-30s. And I asked myself, I don't want to scare him, but maybe he'll listen to this, but maybe when he's 65, you're going to be seeing a lot of issues that are demonstrated relative to the history of his injury.
So this type of therapy can also be seen as a preventative type of
Well,
therapy?
I do think so. I do think so. It can be. There's no studies on it. I'm not going to throw it out that it is preventative, but if you can normalize brain functioning, when you see that there's a trend towards it, my thinking is that it will be preventative in the long run, because you don't begin to see some of these side effects of head injuries until they're in their 50s and 60s.
Right.
And then maybe when you get into your 70s, 80s, when you begin to see some presenile dementia or even dementia. I've done some work with dementia, and I've seen some issues that go on with the elderly. And certainly, I think if I can give anyone any words of advice as you get older, is stay both physically and mentally active, because that's important. What I found with the elderly that I brain map is once they retire, they go into a stage of not doing anything. And so they're not keeping their brain active. And that's where you begin to see the deterioration. And I've seen that with a handful of my clients. And so my goal is to try to bring them back up to where they were before they retired. And so...
Yeah. Well, that's very interesting to hear.
And so there's kind of a lot of things that play into brain health. So this is a really powerful therapy to help kind of, what we're saying is regulate of what's going on. But as you were just mentioning too, there's ways to help feed the brain as well, like having a thriving social community. That's a big part of it. And you see it often, people who retire, they tend to regress because they've lost maybe some of that social community in the workplace, maybe with their family. Also with our foods probably play a big part in feeding the brain. Breath work plays a big part in feeding the brain. So there's a lot of really incredible things that we can be doing with the brain.
You can, outside the context of just what we're doing. You know, we're talking about a colleague of mine who writes, I shared an office with earlier. He recently did a thing on the internet on exercise as an important component of keeping the brain active and focused as you get older. And I believe that.
Yeah, we hear the runner's high, right?
Yeah, exactly.
As often as a term.
And keep doing things. I mean, I'm going to be 80 next year. And so the reason why I'm still working is because it keeps me focused and keeps me attentive and it keeps me involved in things where I keep thinking and I keep problem solving and I keep working at that level that I think it helps me. And I know a lot of 80-year-olds that have regressed quite a bit just because they stop living. You know, they just sit in their easy boy or their lazy boy and they just kind of watch TV all day. And before you know it, they're in a nursing home. And I hate to say it, I say that somewhat facetiously, but I think in many cases it's true.
Yeah, it makes sense.
Yeah.
Well, this was a very interesting and enjoyable talk, Dr. Joe. Thanks so much for
You're welcome.
Joining us.
Yeah, thank you so much for offering the insight. I personally haven't done neurofeedback, but my curiosity is very sparked now, especially to get that EEG testing on the brain just to see what's going on up there. And again, like this idea that you said, just this awareness, bring me into the state of awareness. And I'm sure a lot of our audience feel a similar way or might feel a similar way.
Well, I think so. I think a lot of people are looking for solutions that traditional healthcare can't give them outside the context of medication. Don't get me wrong. I'm not trying to demonize medication, but the net effect is, you know, pharmaceutical companies have tried and attempted to develop medication that would work for Alzheimer's and dementia, and they take them off the market because they don't work. You see, and I personally think that what we do will actually will work. What we found, older brains are harder to train, but what we find is that what we do helps the brain from deteriorating even more than what than where they're at, and that's the real value. I've got several clients that are in their 90s. They realize it, and it helps them. And so we're working, trying to facilitate their ability to stay intact during a period of time in the later years of their life.
So you're giving a quality of life.
That's certainly a big part of it, you know, quality of life. Exactly. To knowing that you are the same that you were 50 years ago and that you're intellectually in tune with things, you know, and not just sitting on a lazy boy.
And then also for the child on the flip side who is going through so much and not being able to make sense of it or understanding it and not feeling like they have a sense of control on it, you're bringing them, again, that quality of life, maybe some of that peace within.
Well, for sure. And with the child, what you're going to begin to see that they're no longer being, you know, put down by the teachers or teased by other kids or bullied or their parents who raise the expectations that they can't meet because they don't have control over it. See, and that's the problem. When we do the quantitative EEG, I can realize why a child has an attentional difficulty or problems in school because their brain just isn't working the way that it should. And then when we bring them back and we train them, then they begin to see, the parents begin to see, and the teachers begin to see that there is improvement here. They did nothing but come to Dr. Joe's office twice a week, you know, for many sessions, but the changes are there. And that's why I'm in the business. My mantra on my websites is, it works.
I love that.
Yes, it works.
Well, for our audience who is curious and would maybe like to have a chat with you, what would be a good way for them to reach out to you to do that?
Well, go to our website.
Okay.
It's nwbiofeedback.com. That has our phone numbers and can contact us. And it also has a lot of information about neurofeedback and biofeedback and what we do. And it also has some references that you can go to that will give you more information about what we do and the research behind it. And we have references for that as well. There's well over 6,000 peer-reviewed journal articles on what we do.
Wow.
And so it certainly will give you good information if you go to places like PubMed, which is kind of the clearinghouse for research articles. You just type in neurofeedback and you'll get all kinds of references and quantitative EEGs.
Well, thank you so much,
You're welcome.
Dr.
Thank you,
O'Donnell.
Dr.
That
Joe.
was so insightful. And thank you for the incredible work that you're doing and being the pioneer for change that I think is so needed now and helping. It's incredible.
Yeah.
Well, it's rewarding for my patients, but it's also rewarding for me. Like I said before, it works.
It works. As simple as that.
Yeah, simple as that. That's as simple
Yeah.
as that.
Well, thank you. And
Yep.
thank you, Hinanti, for sharing and opening about your experience as well with neurofeedback.
Yeah. I just want everyone to benefit the way I benefited, who are struggling like I am, or may not even know that it's ADD or ADHD and just need some guidance.
Mhm.
Got to take that first step. See a therapist, a psychiatrist, or a psychologist, and know that there are other options besides medications that can help you, and you can have a higher quality of life. You don't have to stay stuck.
Amen, sister.
Yeah.
Well, thank you so
You're
much
welcome.
again. I hope our audience enjoyed this episode, and we look forward to
Yeah.
hearing from you guys. All right, take care, Dr. O'Donnell.
Okay, thank you.
Bye bye.
Thanks for having me.